bidirectionally, reciprocally impact one another, meaning chronic medical conditions worsen and exacerbate behavioral health conditions and vice versa significantly. So, a perfect example is somebody with diabetes or cancer, and the co occurrence of depression or anxiety is very high. And when those things exist, you can't effectively manage diabetes. You can't effectively tackle or fight your cancer and go through chemotherapy. You have to treat both conditions. And so people started to understand that. The research started coming out more and more showing how these conditions, impacted one another. And when COVID hit, I think it just shined a spotlight on all of this. Now all of a sudden behavioral health was in like, the national spotlight and everyday vernacular and people talking about their experiences. But then there's another layer to this, which is a little more sophisticated. And this goes back to my very early training in behavioral medicine, which is that there are all kinds of psychological interventions that you can use to better manage and treat and even prevent chronic medical conditions. And so that's where I think we're starting to, like the industry is starting to get that part. Um, and then, of course, the fact that the funding is there, but the reason the funding is there is because organizations like Milliman have done actuarial analysis showing that when you treat behavioral health conditions, there is a corresponding financial offset of the medical cost and the overall total cost of care. And when you can prove that, then it's like a light bulb goes on for the bean counters and the managed care business people going, oh, well, maybe we need to pay attention to these conditions and not just be subjecting them to utilization management and denial of care and all the rest. And
Mhm.
so I think those are some of the things that have begun to pave the way to making this possible.